Tēnā tātou katoa, good evening. Deaths with COVID, people in hospital and reported cases have all skyrocketed this week. We are well and truly in the grip of a second wave. And today, the government released its battle plan for the army of 5 million. It consists of a few basic strategies we can all take part in. The first and best line of defence is to wear a mask indoors, even if you're at school. And 10 million child-sized masks will be available for Year 4 to 7 students. Second, if you get sick, stay home and take a test. Free rats and masks will be available from a number of places, like testing centres. And third, more antiviral medicines will be available. From Monday, anyone over the age of 75 who tests positive will be eligible for them. And they'll reduce at-risk patients' chances of going to hospital by 90%. Political reporter Amelia Wade has more.
A miserable day in Tauranga, made gloomier for some at the prospect of wearing more masks.
Not a fan of wearing masks. I mean, the borders are open, so...
Probably 80% of the people that come into the shop are not wearing masks anymore.
I don't think wearing a mask is too big of an ask.
Well, now the government's not just asking, it's begging.
It will help us get through this darkest part of winter.
My plea to you is to everybody in New Zealand is to do your bit.
To wear masks not just for yourself, but for others.
Mask wearing should be like wearing a seatbelt.
What we mean when we recommend mask use is that you should do it.
And to use the now free rats to...
Test, test, test.
Because our already creaking and straining health system can't take much more.
Hospitals have reported this week over 200 people reporting in sick in any one day.
And it could get even worse. This graph shows the recent cases as white dots. The red line shows what happens if the outbreak stays on this trajectory. There could be 1,200 people in hospital by August. But Dr. Bloomfield says if Kiwis start wearing masks and isolating, it could follow the blue line instead and stay below 1,000.
We can lower that peak if we take steps, if we all take steps.
I mean, if we carry on at this kind of intensity, we could be looking at 5,000 deaths a year from COVID-19. I mean, that is 15 times the road toll.
Professor Michael Baker wanted to see masks mandated more indoors.
We need to shift the norm to being a mask-using society to get us through winter and then reassess in a few months' time.
I hate wearing masks, so...
I think our immune systems are a bit weak because of wearing them for so long. So I just stopped wearing mine.
But despite a surge in cases and a health system under extreme pressure...
We are remaining at orange.
And we're sticking with the traffic light system.
The traffic light system has been complex and hard for people to understand, and inconsistently, it's hard to understand and complex.
I know some people have said that the protections are too complicated for people, but they underestimate New Zealanders.
New Zealanders now being asked to mask up and isolate more.
Well, Amelia joins us now live from Parliament. Amelia, why did the government not move the country to the red traffic light setting?
Yeah, with these reinforced mask rules and isolation rules, we're almost straddling a red and an orange setting. A traffic light rust, if you will. But with the state our health system is in likely 20,000 cases, if not now, when would you move to the red setting? The Minister says because the main difference between the two, the red and the orange, is a cap on mass gatherings, that wouldn't really make a difference because people are catching COVID in their homes and in their workplaces. So if the red setting as it stands doesn't make sense, that means it is no longer fit for purpose.
Amelia Wade live from Parliament. Amelia, thank you.